We have the privilege and honor to have film star, actor, and we all know the name in Bengal industry, Mr. Shivu Prasad Mukherjee with us. Please give a round of applause for Mr. Mukherjee. I'm glad to I'm glad to thankful to the Honorable Consul General of Bhutan, Mr. Tashi Hanjo. Thank you, sir, for coming here. We are thankful from bottom of my heart to have Mr. Arun Mukherjee, the veteran actor, among us. Thank you so much, sir, for giving us time. Thank you. Well, the initiative taken by the person who doesn't need any introduction, not in Kolkata, not in West Bengal, not in Eastern India, probably out of India, India, he is the one of the leading neurosurgeons. And we have the privilege to invite our senior vice chairman, Institute of Medical Education, Dr. Ellen Tripathi, on stage. Sir.
Thank you, Jaideep. I think it's a privilege to welcome you all to this very special day, especially for neuroscientists of the whole world. For the last 9 years, the World Brain Day is been observed for last 9 years, and it's 22nd July. So when there was a suggestion that we should celebrate, I sort of grabbed the opportunity. I'm so happy to see all of you here, especially our Managing Director, Mr. Arnav Gupta. I should call him Dr. Arnav Gupta. Our Joint Managing Director, Mr. Uday Lahiri. Our very special guest, my friend, Consul General of Royal Government of Bhutan, Mr. Tasi Penjor. In spite of his busy schedule, he's been working on various things, especially for Bhutanese people to donate blood for cancer surgery here. I hope the cancer patients will be turned very soon to Medica, and with our cancer being added recently. But he's taken pains. He was in Bodh Gaya yesterday. He especially came for us. Thank you, sir, for coming here. And he's our chief guest. And of course, like Jaideep mentioned, we are very happy to have our guests of honor, Mr. Arun Mukherjee, sir. Thank you for coming. Introducing him to the audience here will be like showing torchlight to the sun. And he's a household name, especially in the world of theatre, Bengal theatre. And of course, our very popular and famous Tollywood director, Mr. Shiv Prasad Mukherjee. And Shiv Babu has been coming to our department, to our hospital very often, but today is a special day. Thank you for coming, Mr. Mukherjee. We are very happy that the press is here for a coverage, and unless we spread the good word around the world, it doesn't help. Today is a special day, especially for our patients. Some of our very dear patients and their families are here, and I want all of you to give all of them a round of applause for being here today. People have come from away from Kolkata, and our invitation, and we will introduce them slowly to one by one to you, and they will tell their story like we did the brain tumor awareness program. So this is basically a brain awareness program, and this year the aim is brain health and prevention. And you'll be surprised to know Professor K.V. Bhattacharya is here, my colleagues are here, Dr. Kaushik Sen, Dr. Anish Ghosh, and of course my own colleagues in neurosurgery, Dr. Harsh Jain and Dr. Sunandan Basu, they're all here. Dr. Nirmala Ray is our interventionist, he is here, and some of our staff, our the marketing department is here. So let's start the day today, and I think at the outset, I will request my colleagues to come and say a few words about the World Brain Day. And first and foremost, I request my senior neurology colleague, Professor K.V. Bhattacharya, to please come over to the dais and say a few words about the World Brain Day. Sir, Professor K.V. Bhattacharya. Sit down and talk, or you're okay? Thank you, Dr. Pati, and welcome you all. আমাকে একটু 10 মিনিট পরে Sorry. This is World Brain Day. So in neurology, we have got several days, like Parkinson's Disease Day on the 11th of April every year, Stroke Day, Epilepsy Day, but this is a composite, and a Brain Day, the whole brain as a whole. Today we are discussing. So as Dr. Tripathi said at the outset, there are two aspects in medical sciences. One is the prevention and the other is the cure. And prevention is always better than cure. There are many neurological disorders which can be cured, but more than that, there are many disorders which can be averted, which can be prevented. And I don't know how to make it a brief talk about what exactly we're going to do on this brain day, all of us. We have got many patients here. That will give you an idea about how Mind Medica Hospital is looking after the patients. I've seen many rare problems here which are undiagnosed elsewhere that could be diagnosed here. And of course, the neurosurgical team in this hospital is an excellent team. Dr. Tripathi, Dr. Harsh Jain, Dr. Sunandan Basu, and others, the DMB students and those who have passed DMB. It's an excellent team and they do a very good job. Neuromedicine also, we have got very good neurologists here. All in all, Dr. Tripathi perhaps will give you a brief resume of what exactly is the plan today in terms of the talks. But I welcome you all on this very auspicious day, World Brain Day. Thank you all very much.
Thank you very much, Dr. May I request my colleague, I'll call you. Thank you. Dr. Harsh Jain to please come and say a few words.
Good afternoon and a very warm welcome. I think there will be a lot of repetition today because we are all talking about the same thing, prevention. Not going into a lot of explicit detail, but just largely when in a neuroscience or neurosurgical or neurology department, we deal with a few common conditions like brain strokes, head injuries, brain tumors, brain infections and the like. Now, who has a brain tumor? I don't think there's a lot of people that can control why someone would have a brain tumor, and there are probably not a lot of known reasons to have a brain tumor, for example. But the vast majority of the patients who are coming to us are with brain strokes and head injuries, and these are actually preventable. And I think this is the most important message that we would like to give across, that this impact of non-communicable diseases, the chronic ailments like diabetes, hypertension, smoking, obesity, lack of exercise, these are actually contributing to a vast amount of ill health in our community than the other things like brain tumors, etc. So if we can make certain important lifestyle changes like avoiding alcohol, stopping smoking, getting enough exercise, correctly and timely diagnosis of hypertension and diabetes, we can actually prevent patients from coming to our hospital with these very potentially serious, life-threatening, and probably worse off is that patients coming with brain strokes and head injuries, it is the impact on the families and caregivers, which is probably more debilitating than to the patient itself. So I think the most important message is that if we can make these lifestyle changes, we can, because we are seeing increasingly, I mean, traditionally we've known that, patients coming with stroke, oh, it must be an elderly person, 60s, 70s, it's common to have a stroke. But we are now seeing in our outpatient department patients in their 30s and 40s and 50s coming to us with very severe disabling strokes. Just yesterday we had a person, 52-year-old gentleman who's coming with a stroke which is non-salvageable. So, but if you can And the other aspect is that diabetes and hypertension, these are silent killers. Many years may elapse before you are actually diagnosed. 1 in 3 people in this country do not know that they have hypertension. We do not even know the definition of hypertension. So if these are actually caught early, then a lot of these vascular diseases can be treated and prevented, and you can actually prevent the whole burden of stroke in our country. Of course, we can also talk about head injuries, because we know these are also preventable. Simple things like, adhering to driving rules and practices, wearing seat belts. There's no discussion about it. But these are simple acts. If we can incorporate in our day-to-day lives, I think we can make a huge difference. And I think that is a key message that I'd like to give. That prevention is possible, it is in our hands, and it is very simple lifestyle changes that can help them. Thank you very much.
Thank you. So, like to really emphasize on the essential 8. So nowadays we talk about the essential 8 of prevention of brain diseases. So you know that the body weight, exercise, good sleep, control of blood pressure, diabetes, lipids, avoiding nicotine, as you rightly mentioned. So essential 8 is the main theme of the prevention of brain, especially brain diseases, especially for this particular year. So with this, I will invite my colleague Dr. Sunandan Basu to please come and share a few of his experience and say a few words on this occasion. Dr. Basu, please.
Good afternoon. It's a great pleasure that on the World Brain Day that we are speaking with my colleagues Rashmida and means the CG is over here, but the most important person I would be seeing over here is Shantanuda. I'm really happy to see you, and Orunda, one of the veterans, and I was really amazed the way he's made a recovery from his that he was, I don't want to mention, but he's gone back to again acting. That is the main thing what we love to see. Same Shiva Prasad, he was injured, but he's back to acting and everything. So these are the things which on the World Day, I don't want to take a lot of time of yours. That's the main thing. What I would say, exercise is the mainstay of treatment. Control your blood pressure, control your sugar. That's the mainstay of treatment, what I would say. And if we can do the exercise and everything, we would be leading a lot better life compared to other people. And that's my advice to all of you. Thank you very much.
Thank you. Thank you, Basu. So next would have been Dr. Kaushik Sen, our senior neurologist, but he's just gone down for looking after a very acute stroke case. So I request my colleague Dr. Anish Kumar Ghosh to please come and say a few words on this occasion. Anish, please.
Thank you, sir. And Medica welcomes you all. A very good afternoon to all of you. As a neurologist, stroke comes first and foremost in our mind. Already doctors have told about the prevention of stroke, like prevention of some modifiable risk factors like obesity, hypertension, blood sugar, quitting of cigarette smoking. And there are also some non-modifiable risk factors like genetic disease, genetic sources which cannot be prevented. And another aspect I wish to highlight is that to promote awareness, we also commemorate these days like World Brain Day, World Stroke Day, and the like to increase awareness among the population. A study done in India a few years back found that in spite of mainstream media, social media, there still exists around 30% of the population, both in urban and rural areas, who could not recognize the stroke symptoms, and there were 10% who even did not know that stroke was a disease which occurred in the brain. So this is a day which we utilize to promote awareness, like whenever you have an acute facial deviation, slurring of speech, or one arm falling down continuously, or a loss of balance, acute loss of balance, so rush into a nearby hospital, as there are some acute injections available like thrombolytic therapy, which used judiciously within 3 hours, and to some in some patients up to 4.5 hours can lyse that clot, and can decrease the disability of that stroke after 3 months. Because a stroke not only creates a lot of disability, it creates a lot of socio-economic burden on the patient and his family. And there are other diseases which can also be prevented, like headaches, common headaches like migraine, with good lifestyle modification, not watching mobiles all the day, decreasing screen time, reduction of your colas and all the junk food you eat, reduction of the caffeinated food and drinks, all helps to reduce migraine. So with these two issues, I welcome you all to enjoy the program. Thank you very much.
Thank you, Dr. Rose. Is Dr. Nirmala here? Can I call him, please? Please come. So Dr. Nirmala is our intervention neurodiologist, and he's got a special training on treating aneurysms and AVMs, and is a very important member of our family. Dr. Nirmala.
A very good afternoon to all of you. Happy Brain Day, World Brain Day from our side, from the team Mind Team side. I have joined this team for the last 5 months, and I am a neurointerventional radiologist. As you all know, that it appears that all brain surgeries require cutting the skull, but we do it by a very small pinhole through either in the groin or the wrist. We can reach the brain and treat a lot of complex neurovascular cases, and particularly in the setting of acute ischemic stroke that Dr. Anish was telling. So besides the thrombolytic therapy, now a new treatment has come up that is called mechanical thrombectomy. In that, we can remove the clot in the brain through a pinhole in the groin or in the wrist. So the clot is sucked out of the brain, and a lot of patients make an excellent recovery after doing this procedure. But just remember, for any brain emergencies, it is the time that is the most important thing. And you have to reach to the nearest stroke ready center as early as possible, like we have, where we have a 24/7 cath lab facility, 24/7 CT or MRI scan facility, which is of utmost importance, and we need to do these patients as early as possible. So, as Dr. Anish has already said, identify the signs and symptoms of the stroke as early as possible, and remember, unless these treatment are these diseases are treated as early as possible, that causes a definite socioeconomic burden to the patient. As you all know, that heart attack can kill a patient, but brain stroke, that can not only kill a patient, it kills a family, because the patient becomes dependent on other family members because of the paralysis that happens with the stroke. So we should all reach, these symptoms should be identified at the earliest, and we should reach the nearby stroke ready center like Medica, where we can treat this patient at the earliest. Thank you. All.
Thank you, Nirmala. I think you rightly mentioned about the stroke, and while we speak, there may be a case to be treated very soon. So Dr. Sen has gone down. Please help. Thank you, Nirmala. And I think we will wait for Dr. Kaushik. And so with this, may I request Dr. Ainab Devgupta to please come over and felicitate the chief guest of this special function, my friend, our own Consulate General of the Royal Government of Bhutan, Mr. Dasi Penjor, please. Please come. You go to the near. Please. And come this way. Be careful. So felicitate him. Thank you for being here, sir, and we are pleasure to have you. We know that. And this is special plan for you to remember us. Please take a seat, Mr. Penjor, and I request Mr. Dr. Ainab Devgupta to say a few words on this occasion, especially since he's here.
Thank you, sir. Neuro has been one of our pillars of the hospital from the day one, and Dr. Tripathi is symbolic of our neuro department in the team, and we rightfully call it MIND, Medica Institute of Neurosciences, and not only in Medica, I think Dr. Tripathi's contribution along with Dr. Jain, Dr. Sunandan, has been for the entire Eastern India. I mean, I still remember Dr. Tipu Aziz coming over from Oxford for the brain stimulation, and these kind of things were not heard in this part of the country. For anything advanced, you have to go out of East, out of Bengal. And that's the thing that's been changed significantly over the years. And with Dr. Nirmalo joining in, I think it's added another complete different angle to our program. Dr. Anish and the entire neuro team, neurologist team has also been supportive. But I think it's time that we take to a different level. The stroke program is something that has been in plan for a very long time. I think we're kickstarting that in a big way and going forward. And Bhutan and Medica Mind team has a very old relationship. Dr. Tripathi will tell you. We started off early days, and I still remember seeing a picture. Did you talk about it, sir? All right. So there was this gentleman, politician, who had come over with an arrow in his head, and he came here with that from Bhutan. And I think he went back and he was cured and he got back to his normal life. I had never seen. I heard of all this in movies or books, but seeing it the first time was mind-boggling. And that's when he realized how less is the difference between doctors and gods. You know, they can save life by doing that, and that's so powerful. Thank you, sir. All the very best for all your oncoming programs at Neuro.
Thank you, Arnav. Very kind words. Thank you for felicitating. So, with this, I will request our chief guest of this program, Mr. Tansipendra, to say a few words. But before if you want to stay here, or you can sit in. Before you start speaking, let me tell you that friendship, especially with Medica Neurological Institute, and myself, especially personally, and of course Dr. Jain, I've been to Bhutan for almost 20 times, and we've met Prime Minister, Health Minister, any minister that we get the chance to meet, and most of it is through our friend, like Dr. Devgupta mentioned about his arrow injury, Ugen Tenjin. He is the MP, he was MP, in fact, recently lost. A very, very helpful man, and we have operated more than 700-800 routine patients in this hospital, and bit more added for other hospitals. I won't say that, but it's very really pleasure to have you this afternoon, and you kindly say a few words. Thank you very much for coming.
Honorable MD sir, Joint MD, very distinguished Dr. Tripathi, and also very accomplished esteemed members here from different walks of life, especially from film, from acting, from direction, and also other doctors who are highly accomplished. And on top of that, all the guests here, people from media, ladies and gentlemen. Today, it is indeed a great, great honor for me to be amongst all of you here to celebrate the World Brain Day. I have nothing much to add on the subject matter, but I feel that it is a day for us to recognize, to acknowledge, to show our respect, besides advocating and sensitizing people on the importance of the brain, as it is mentioned here. The mind matters, and is the key. Bhutan, as the Honorable Joint MD and Doctor has mentioned, Bhutan and Medica have enjoyed a long relation, and Bhutan has really benefited from Medica, from the services of Medica, and especially as narrated by Joint MD sir and Doctor himself, one of our MPs who had come here, everybody in Bhutan thought that he would not survive. But he has come back miraculously, he has survived, and even he served another term in the parliament. So that has become a a miraculous story back in Bhutan. And because of these incidences, Medica is well known in Bhutan. And I hope in the future also lots and lots of Bhutanese patients who come here get and cured and benefit of the specialized services offered by Medica. I hope we will carry forward these long relations and look forward to having a very good win-win working relations in the coming future. And with this, from my side and from all my people in the consulate, in particular, and people of Bhutan, would like to thank all the specialist doctors here, the management, and the health professionals for giving very good attention and curing our people and reaching back on time to the country. Thank you very much, and Jashi Dile.
Thank you very much, Mr. Abhishek. Thank you very much for your kind words. With this, I personally thank you as well. And on behalf of Medica and all of us, really very grateful to you to have come. Please, good. So, with this, we move on to our felicitating our guest of honor and none other than Mr. Arun Mukherjee. So, may I request somebody to please help Mr. Mukherjee? And I request our Joint Medical Director, Mr. Uday Lahiri, to please come and do the honors. Uday, please. So, well. Thank you for coming. Okay. The face of Bengali theatre, the veteran, Mr. Arun Mukherjee. A special association with him, and I want him to please one glad for you. Record it. Thank you, Arunda, for coming this afternoon. And with this, I'll request Mr. Lahiri to say a few words, and you can take a seat. And we'll request you to say a few words, share your experience, and give us message.
Good afternoon, everyone, and welcome to Medica. Honorable Consul General, sir, dignitaries, my press friends, and fellow colleagues. It's a wonderful thought that Dr. Tripathi has taken this initiative of starting this celebration on World Brain Day. It's very, very important to emphasize why we are talking about brain. If you really look inside, everything that we do here, everything, every aspect of our life is controlled by our brain. As we talk, our thoughts, our movements, our touch, everything that we do in our lives is controlled by our brain. But at the same time, we do not take as much care of our brain as we do for, say, our heart or other parts. We are more worried about other organs, but we don't really look at brain as a organ which takes care of us from the time we take birth to the time we meet our end. So it's imperative that we look at the brain health. We look at various precautions that can be taken for ensuring that we have a good life. And I would not get into details, like clinicians have already spoken about what are the precautions and what all can be done. But I'm very, very proud standing here as MD of this company to say that we have clinicians who are extremely skillful. Many hospitals will have equipments, many hospitals will have a lot of big, beautiful buildings. But Medica has been focused, and we have been able to attract, retain, and keep our doctors happy. I think Dr. Tripathi would agree there, Dr. Jain would agree there. that we've been able to keep them here with us for a very, very long time. And I think from the part of management, that's been our biggest achievement. We've been able to get clinicians who are now state-of-the-art kind of work where we do not operate like the doctors are talking about, that we can release clots inside the brain. We talk about angiograms and angioplasties of the heart, but we do not know that yes, there are possible procedures which can also be done with the brain, and where without being invasive, without being very surgical about it, a lot of things can be addressed. So that's one thing that Medica would continue to do. We are the forebearer torch of modern treatment, and my staff and we are committed to ensure that facilities to our patients, their families are of the top notch. Thank you all for coming here today and making this day a memorable one. Thank you.
Thank you, Uday. Uday and Ayana, they are the two big pillars of this Medica movement. And, for me, they are like my younger brothers, and they are managing directors, both of them. And the hospital has a lot to really thank. Thank you very much for coming today, this afternoon. And please take your seat, and thank you very much. So with this, I will request Arunda to say a few words. আপনি বলতে পারেন যেটাই আপনি বলুন আচ্ছা একটা থিয়েটার দেখতে হবে আপনার মানে পার্সোনালি
World Brain Day. Brain is the main thing. We know it operates on different level. But what I felt from coming here for treatment, that heart, mind matters. I want to sing two lines from one of my plays. Before that, I want to thank Dr. Tripathi, Dr. Sunandan Bosu, and other doctors and nurses and everybody who treated me with care and love. That is the main thing. Doctors should only not be expert in their profession, but should have a good heart, good mind for treatment of the patients. প্রকৃতির কত লীলা, মানুষের কত রূপ, মানুষের কত রূপ, বাঁচতে যে কি সুখ রে, বাঁচতে যে কি সুখ, বাঁচতে যে কি সুখ রে, বাঁচতে যে কি সুখ. What a privilege to live. And doctors help everybody to extend their lives span. Thank you.
খুব ভালো লাগলো thank you so much thanks for coming all the way and taking all these pains for us and blessing us. Thank you very much. Namaskar. So now the next stage of our observation of this World Brain Day is our dear patients, and we have tried to invite some of our very dear patients, and before that we will felicitate Mr. Shiv Prasad Mukherjee, and I will request my colleague Dr. Sunandan Bosu to please come over and felicitate Mr. Shiv Prasad Mukherjee. I don't think I need to introduce him to you, this audience especially. you very much, Rahul. Can I request you to say a few words, please, on this subject? Okay. Please.
Today is the World Brain Day, and I must say that Medica is my family. And every time, whenever I'm here, I always say this. 11th August 2022, my mother was admitted here under the neuro department, and I'm really grateful. My family, everyone, my family member, all of us, we are grateful to the Department of Neurology, the department, all the doctors, all the staff, Dr. Tripathi, Dr. Jain, especially Dr. Basu. Dr. Basu is like my elder brother, and especially that person, Komal. I mean, Komal organized everything at that point. I think people say that, the golden hour is very important. Medica organized every single thing within that golden period. I will never forget that. And this hospital, they gave my mother a new life. I'm really grateful. My mother is fine, and she's doing absolutely fine. Thank you, Medica. Thank you very much.
Thank you so much for sharing your personal experience. We personally, I'm grateful to you to have come for this occasion. And with this, we invite all my colleagues, Dr. Jain, Dr. Nirmalya, and then of course our special guest, chief guest, Dr. Sajjad, Arunda, please to come over for a photograph, and then we will get to our patients to listen to their story. Please, Sajjad, please come. Kindly. Dr. Anish Ghosh, Professor Bharatiya is here, or Anish, please come.
আপনি এখানে এগিয়ে আসুন হ্যাঁ সামনে আসছে কেন সবাই আসছে তো হ্যাঁ বেদ বাবার পিকচার নাও এই দাঁড়াতেও দিচ্ছে না বসে হাত চলে আসছে এই সুপ্রিয় হাত চলে আসছে Thank you all.
Thank you very much. Thank you, Randa. Thank you. So, as I said, we will go to our patients to listen to their stories. So, it will be a very exciting part of the program. Video? Okay. So, ভিডিওগুলো দেখাবে এখন? We have some messages recorded earlier for all of you on this special day. We will tell you about the awareness of and treatment of brain tumor. Diagnosis can be done on symptoms, headache, vomiting, convulsions, fits, as I like to say, and also paralysis. CT scan MRI will clinch the diagnosis, and for that we have a very specialized brain tumor operation facility here with all its equipment.
After operation, we know the diagnosis from biopsy and IHC, and then give the specific treatment if necessary, chemotherapy and radiotherapy, for which we have all the team necessary in Medica itself, and is one of the best centers in Eastern India to do this treatment, especially for brain tumors in adults and children. Especially on the World Brain Day occasion, which is 22nd July, we want to raise the awareness of brain tumor and let you know that we are one of the best centers for brain tumor surgery and treatment.
উপদেষ্টা এবং তথাকথিত উপকথা আমি আপনাদের পার্কিনসন ডিজিজ সম্বন্ধে কিছু কথা বলতে চাই। অনেকে আপনারা জানেন অসুখটা কি? সাধারণত অসুখটা একটু বড় বয়সে হয়, 40-এর উপরে 50 এরকম সময় যদি হাত কাঁপে, পা কাঁপে, সেটা আপনার সবাই বুঝতে পান। হাত পা শক্ত হয়ে যায়, নড়াচড়া করতে অসুবিধা হয়, কথাবার্তা জোর দিতে পারে, এছাড়া আরো অনেক কিছু হতে পারে। এই অসুখটা সম্বন্ধে এখন একটা সবচেয়ে বিস্তারিত কথা হচ্ছে, আমাদের মধ্যে চিকিৎসা ছিল না, এখন প্রচুর ওষুধ বেরিয়ে গেছে। তো সেই ওষুধ এমনকি অপারেশনের মাধ্যমে আমরা এই অসুখের নিরাময় করতে পারি।
On the occasion of World Brain Day, 22nd July 2024, we would like to raise awareness regarding these minimally invasive or keyhole or endoscopic approaches to the brain. These are operations done through the nose conjointly with the ENT department, utilizing endoscopes or telescopes. And these are very elegant operations, very complex tumors involving the pituitary region, the front of the skull base can be done through these approaches. The advantages are they are minimally invasive, there is no cut or scars involved, and the recovery is usually painless and short. We at Medica have all the facilities and the skills and the various departments that can finally deliver a very good outcome to these sometimes very complex lesions.
নমস্কার, আমার নাম ডক্টর সুনন্দন বাসু, কনসালটেন্ট নিউরোসার্জন মেডিকেল সুপার স্পেশালিটি হসপিটাল। ওয়ার্ল্ড ব্রেন ডের জন্য আমি কয়েকটা কথা বলছি। আমার স্পেশাল ইন্টারেস্ট অফ টপিক হচ্ছে পার্কিনসন্স ডিজিজ। এটা জেনারেলি দেখা যায় যে পার্কিনসন্স ডিজিজের ইথিওলজি আমরা যদি জানতে চাই, তাহলে এটা হচ্ছে জেনেটিক, কিংবা অনেক ক্ষেত্রে দেখা যাচ্ছে যেটা ফ্যামিলিয়াল ডিজিজ। পার্কিনসন্স ডিজিজ যেটা হয় সেটা হচ্ছে হাত পা কাঁপা, ব্যালেন্স প্রবলেম, মেমোরি প্রবলেম। মোস্ট অফ দ্য কেসেসে আমরা দেখি যে এটা ওষুধ দিয়ে ম্যানেজ করা যায়, কিন্তু কয়েকটা ক্ষেত্রে আমরা দেখি সার্জারি করলে যদি আমরা ব্রেনের মধ্যে একটা পেসমেকার লাগিয়ে দিতে পারি, এই পেশেন্টরা কিন্তু খুব ভালো পড়ে। কিন্তু এটা সিলেক্টিভ কেসেস। আশা করি আপনাদের ডায়েট এবং এক্সারসাইজ করবেন, সেগুলো কিন্তু দ্য মেইন স্টে অফ ট্রিটমেন্ট ফর এনি সর্ট অফ ডিজিজ ইনক্লুডিং পার্কিনসন।
আমাদের সবারই কখনো না কখনো মাথা ব্যথা হয়, সেগুলোকে বেশিরভাগই আমরা কেউ গ্রাহ্য করি না। অল্প একটু মাথা ব্যথা হলো, একটু প্যারাসিটামল খেলাম, স্যারিডন খেলাম, ব্যথা কমে গেল, আবার কাজে চলে গেলাম। সেইগুলো দুই একটা আমি আপনাদেরকে বলতে চাই। মাথা ব্যথাটা হঠাৎ করে পরিমাণ এবং ইন্টেন্সিটিতে খুব বেড়ে গেল। আগে ধরুন মাসে 2 বার করে হতো, এখন সেটা মাসে দেখা গেল 15 বার বা 20 বার করে হচ্ছে। আগে 5 মিনিটে মাথা ব্যথা কমে যেত, সেটা এখন 2 ঘন্টাও মাথা ব্যথা কমছে না। মাথা ব্যথার সঙ্গে প্রচুর পরিমাণে বমি হচ্ছে, মাথা ব্যথার সঙ্গে চোখের দৃষ্টিশক্তি কমে যাচ্ছে, হাত পা ঝিমঝিম করছে বা হাত পা একদিক অবশ হয়ে যাচ্ছে বা খিচুড়ি বা অজ্ঞান হয়ে যাচ্ছে। এই জাতের মাথা ব্যথাকে কেউ যেন অবহেলা না করে, সঙ্গে সঙ্গে ডাক্তারের পরামর্শ গ্রহণ করবেন এবং ডাক্তারবাবুরা যেরকম বলবেন সেরকম অনুযায়ী ওষুধপত্র এবং চিকিৎসার ব্যবস্থা করলে কিন্তু এই মাথা ব্যথার যন্ত্রণার থেকে আপনারা মুক্তি পাবেন। নমস্কার। Stroke is the most common medical neurological emergencies, we all know, and that is why the recognition of stroke and its prevention is important. Stroke creates a lot of disability in patients and as well creates a lot of socio-economic burden.
We have an acronym FAST to recognize stroke early. That is F for facial deviation, A for arm drift, S for speech, and T is the time of onset of stroke. That is very important because now we have some thrombolysis therapy as well as mechanical thrombectomy, which have a stipulated time period to perform whenever the patient comes to the hospital. Like for thrombolysis, we have 3 to 4.5 hours, and for mechanical thrombectomy, for conventional ones, we have 6 hours, and in some cases, selected cases, even 24 hours.
On the occasion of the World Brain Day on 22nd July, I would like to spread awareness about the field of neurointerventional surgery. In this field, through a small pinhole in the groin or the wrist, complex neurovascular diseases of the brain can be treated, like acute ischemic stroke by mechanical thrombectomy, or complex brain aneurysms, arteriovenous malformations, or fistulas, or even the intracranial stenotic or extracranial stenotic diseases. The need of cutting the skull can be avoided by this exciting field of medicine, and patients can be discharged home very quickly with full recovery in a very short time.
এই যে স্পাইনাল কর্ডের যে প্রবলেমটা হলো সেটা কেউ ঠিক আন্দাজ করতে পারছিল না। তারপরে আমি মেডিকাতে ভর্তি হলাম। মেডিকার সঙ্গে আমার সম্পর্ক আসছে না। যারা মেডিকেল চিকিৎসা করান তারা প্রত্যেকে এই কথা মানবেন, আমার এই মানবেন যে হিউম্যান কেয়ারটা চিকিৎসার সঙ্গে থাকলে রোগী তাড়াতাড়ি সুস্থ হয়। যেমন আমার হলো, প্রথম দিক থেকে কেউ তো ধরতেই পারছিল কি হয়েছে। হ্যাঁ, আগামী 22শে জুলাই ওয়ার্ল্ড ব্রেইন ডে, আর এটা আমরা সবাই জানি যে ব্রেইন ইজ দ্য মেইন থিং। সেই সেমিনার একটা হবে, আপনারা সময় করে সুযোগ করে আসুন। আমিও যাওয়ার চেষ্টা করছি, না যাবো, অসুবিধা হলেও যাবো, মেডিকা বলে যাবো।
নমস্কার, আমি শুভপ্রসাদ মুখোপাধ্যায়। আগামী 22শে জুলাই ওয়ার্ল্ড ব্রেন ডে, মস্তিষ্ককে সুস্থ রাখার দিন, ভালো থাকার দিন। ওই দিন আমি মেডিকা হসপিটালে থাকবো। আপনারা সবাই যারা যারা পারবেন তারা আসবেন, আপনাদের সকলের সঙ্গে দেখা হবে। আমাদেরকে ভালো থাকতে হবে।
Thank all speakers who have given bites for this special day. With this, we'll request our patients to come, and first I'll request Professor Abhishek Banerjee, Subro. Professor Banerjee. Professor Banerjee is a retired cardiologist from PG, from medical colleges, and is voracious practitioner now. But his medical history will take a long time for me to tell you, but he is going to tell about himself through an electrolarynx. So I request Professor Banerjee to please tell a story about him, and I can just briefly say that we had to put on a shunt on him, a programmable valve shunt, and we adjusted the pressure, and he had this hydrocephalus because of a posterior fossa cavernoma, and he had quite a few operations in the past. He's going to tell us about it. Sir, please.
Well, it's a long journey. I suffered from the carcinoma of the larynx as well as the lung. Carcinoma of the larynx as well as the lungs. It was detected in 2007, underwent treatment to 2009, had a relapse and was underwent a laryngectomy operation in 2009
In USA.
Because my friend, he was an oncologist in USA. He took me there. Subsequently, in went on. I was doing many things besides practicing medicine. I was doing cardiology, teaching students, and I was having a nice life. Suddenly, in between, Mr. Shivaprasad Mukherjee asked me to come along and act in the film Konto, in which I have acted for a small period role. Subsequently, while I was enjoying my life as a film star, I went down with hydrocephalus and all the problems like walk gait abnormalities. I was behaving abnormally, and that was the time when Dr. Tripathi, for the second time, but was my classmate. Second time he took me out of that very big pit, and I was started now enjoying life again. I would like to thank Dr. Tripathi for all the good work that he has done for me. Thanks a lot.
Thank you, sir. When you came over, I remember you came on a ventilator from the other hospital.
Yes.
And